So thanks, everyone. It was wonderful to hear your report back from your discussions. And I look forward to getting your questions as we talk more about where we are when it comes to primary care in Canada. So earlier today heard from Ruth about where, what primary care is and what it's like in Nova Scotia. And then Leah Jones supplemented that with some data about health. And today I'm going to be talking to you about the results of the survey that we did as a first phase of OurCare. This survey was really designed to take the pulse of people living in Canada. So it's not Nova Scotia based, it's all across the country. And of course, it's a snapshot because it is a survey. So it was done at one point of time and we weren't able to go in depth. But I'm looking forward to providing you with a summary of what some of the insights we gained were from this survey. So apologies that I think my slides advanced without me. There we go. So all told, we put the survey out in the fall of 2022, and there were two ways in which people could participate in the survey. So for one, we just put out an open link that anybody could answer. But then we also actually partnered with Vox Pop Labs, who are an organization that really support and promote democratic participation. And they have a panel of about 700,000 people in Canada. And they were able to send this survey out to many people within their panel. And as a result of all of that work, and we also promoted it a lot through social media and traditional media. And as a result of all of that, we ended up receiving about 14,000 people who responded to the survey. And of those who responded, just over 9,000 completed the full survey. And those are the people whose data we were able to include in our analysis. About 3/4 of the responses were in English, and about 1/4 were in the French translation of the survey. The reason we had to only include people who completed the full survey was that we needed people to get to the very end of the survey so that they could complete the demographic questions, including, telling us their gender, their age, their education, income, language, and region. And based on those 6 factors, we actually weighted the survey so that the responses were more likely to match the demographic population in Canada. So for example, our survey, actually, we heard from many more women than men. And so each response from a woman would then be weighted less than the response from a man, not be discounted at all. They're definitely counted. But the weighting ensures that the respondents are more demographically representative than perhaps would have been the case if we didn't, would have been the case if we hadn't weighted the responses. As just before I launch into what some of our findings are, I wanted to, though, just caution about some limitations of the survey. So we did notice that, the survey probably underrepresented some groups, including people new to Canada, people who are racialized and Indigenous. Of course, we did have a bilingual survey, but that still excluded many people who may not have been comfortable in English and French. It was, a 15-minute survey that you needed to have access to the internet to complete it. We actually did also partner with some community health centers that supported people to do it in person. However, that was fairly limited, and the feedback we got was that, it was challenging for some individuals. And like I said, it captures one point in time and wasn't designed to reflect the care delivered by the care delivered in Nova Scotia. It's a national sort of snapshot I'll give you. Having said that, we'll talk a bit about where Nova Scotia might stand out. So to start, I think one of our major findings from the survey was that far too many people in Canada don't have a family doctor. So about 1 in 5 adults reported not having a family doctor or nurse practitioner they could see regularly for care. And so that 22% translated to about 6.5 million adults 18 and over. And what was really striking as well was that there was huge regional variation. So what you can see kind of in this image here is that actually the proportion reporting that they didn't have a family doctor or NP in Ontario was 13%. But contrast that with BC, where it was 27%, so just over 1 in 4. And then Quebec and the Atlantic region, where it was 31%, so almost 1 in 3 people not having a family doctor or NP. It was also, it's also important to note that there were other differences in terms of who reported having or not having a family doctor or NP. So you see people who were living with a higher income, women, people actually over age 65 were some groups who were more more of them reported having a family doctor or NP. Now, importantly, I will say though, when we especially look at the age differences, even though it was, far more people age 65 and over had a family doctor than those 18 to 29, it still meant that 14% of those over 65 were saying that they didn't have a family doctor or NP. And if you're over 65, you definitely need a family doctor or NP. So I'd say that, that's nowhere near where we want to be. Importantly, we asked some questions that just helped us to understand the care that people were receiving if they did have a family doctor or NP. And so one of those questions was, is there someone else in the practice that you see that would be available to help you with urgent issues outside of Monday to Friday, 9 to 5? And we can actually see that, almost 40% of people said no, that they wasn't someone, and an additional 27% said they didn't know. So lots of people, unfortunately, don't seem to have coverage in their family practice outside of that Monday to Friday, 9 to 5 hour. We also asked a question just about timeliness of urgent appointments. So we asked if they were able to get if they needed an urgent appointment in the last 12 months. And then we asked how long it took them from the time when they tried to book the appointment until they actually had the appointment. And only 35% said they were able to get a same or next day appointment. And interestingly, like 1/5 of those who tried to get an urgent appointment had to wait 2 or more weeks or were never able to get one. So how about those without a family doctor? So when it comes to those without a family doctor, we can see that we ask them, where are they getting their care? And people listed a whole bunch of different things. So we actually asked, do they have another healthcare provider? And I should say, actually, only about 12% said that they did. And of those 12%, a common answer was, yeah, it's my specialist doctor who's my regular source of care. Some people said a pharmacist, some people said a nurse, and then there were a whole bunch of other responses that we got as well. Now, of the people who didn't have a family doctor, the top 3 places where we asked them, what did you do when you had a health problem that was worried but was not urgent? Where did you go? And so even though this was a not urgent problem, but worrisome, we see that, about 50% said that they went to an in-person walk-in clinic, 27% said a virtual walk-in clinic, and 24% a hospital emergency room. This was one of these case questions where you could select all that applied because they may have gone to more than one place. So we see those are really the top places where people are trying to turn to for care, non-urgent care, even when they don't have a family doctor. Interestingly, among people who don't have a family doctor or NP, about 21, of those people who without a family doctor or NP who tried to get care when they had a health issue, about 1 in 5 or 21% had to pay a fee. And then we asked them, what did you have to pay this fee for? 80% of the time it was actually for the appointment itself. 40% of the time it was for medications or supplies. Unfortunately, the way that we asked the question, we can't tell, what was the setting where they had to pay the fee. So it might have been that they paid the fee to see the naturopath, but it might have also been that they paid a fee to see a provider in a certain setting. So we weren't able to disentangle that or understand that. We then asked people about whether they're trying to find a family doctor and what that's like for them. So about 29% of people were trying to find a family or doctor or NP. And what we found is most had been looking for less than 2 years. And interestingly, about 1/3 of people who were looking for a family doctor actually 1/3 of people who were looking for a family doctor did have a family doctor already or NP, and about 2/3 didn't. Also interesting is that about 1 in 5 people without a family doctor or NP said they weren't looking for a family doctor. And some of the reasons were, that they thought they were healthy, that they were happy to get care from a walk-in, but some of it was also just that that there were no family doctors and NPs accepting patients in their area, so they just stopped looking, or that they've just been trying for a while and basically given up hope. We asked people, why are you trying to find a family doctor or NP at this time? Sometimes it was, and particularly, we asked this question to people who already had a family doctor or NP. And so it seems, some people who had a family doctor or NP were looking for a new one because they weren't happy with the care that their provider provides, or for example, because their provider's office was too far away, or they recently moved. So those were the top reasons. In the next section of the survey, so we asked more about what is important to people when it comes to primary care. And we really summarized that in this infographic here. So importantly, 98% of Canadians felt it was important that everyone have access to a family doctor, NP, or team of health professionals that they could see regularly. So it was a resounding endorsement of the importance of primary care and everyone having access to that. And then we asked them a series of about 11 questions that related to, what they felt was important. And the number one thing that people ranked as being most important was that their family doctor or NP know them as a person and consider all the factors that affect my health. But people also really valued, all of the 4 C's that Ruth talked about earlier today. So we can see, they make it easy for me to get care during the day. Was highly ranked, as was they are able to provide most of my care. So that relates to comprehensiveness. They coordinate the care I get from multiple places, so care coordination. And then back to this relationships, they stand up for me. 88% also thought it was important that their family doctor or NP were close to their home. And we asked about people's access to their own records. 75% said that it was important to have access to their online health information. And 93% said it was important to have one personal health record where all health professionals who care for them in the province could see their information. So this is picking up on some of the comments I know many of you have already started to make. Now, we talked about this already. So the next section was about walk-in clinics. So when it comes to walk-in clinics, we actually see that many people in Canada are getting their care there, are getting some care there. So 47% of people who responded tried at least once to get care at a walk-in clinic in the last 12 months. Most of the time, they saw a walk-in clinic in person, 77%, but 33% had an encounter by phone, 12% by video, and 5% via online chat. And they could pick more than one modality. So those could add up to more than 100%. We asked them why they tried to get care at that walk-in clinic. Some of the time it was because, the most common answer was that the walk-in clinic was the only place I thought I could get care from at the time. Other common things was that they didn't have a regular healthcare provider, or that they were unable to get an appointment with my care provider or team as soon as I wanted, or they were just simply unable to get an appointment with the health provider or team. There were also some people who said I just needed care for a small health issue. We also asked people about new virtual walk-in clinics services that were available and sprouted up really in larger numbers during the pandemic. So in these new virtual services, you can usually easily connect with a doctor by phone, video, or online chat, but you may not know the doctor may not have access to your health records, and the doctor may not be able to schedule a follow-up appointment in person. And so we asked people, how willing would you be to use these virtual walk-in clinic services? About 57%, interestingly, said they were not willing to use these kinds of services if the service was owned by a for-profit company. 70% said they weren't willing to use one of these services if the company that ran the service received payments from or was owned by a pharmaceutical company. 78% said they weren't willing to use the service if the service charged from them for things they could get for free from the regular doctor or NP. And 84% said they weren't willing to use the service if the company that ran the service sold their health data to a pharmaceutical or insurance company after removing information that could identify them. Now, why did we pick these examples when we asked about willingness to use the surveys, these services? Well, we know that actually all of these things do happen. And so I would say, and we also know from earlier parts in the survey that I just presented that many people are seeing virtual walk-in clinics. And I think, one of the things that we've explored in one of the blogs that I'll tell you about is that there's this tension because people don't have a place to go. And so they end up seeing a virtual walk-in clinic because that might be their only option. But at the same time, it seems to not align with what they would ideally want in a healthcare system. So ideally, it seems that they wouldn't want to attend a virtual walk-in service where their data is potentially being sold, for example, or where there's profits going to a pharmaceutical company. Now, I will also say that I suspect that some people who answered in this way, so people when they were asked directly, they answered in these ways, but when they're using the virtual walk-in services, often people actually don't realize that some of these things are happening in the background. So people can, I know we've all done it, click through those agreements really fast and not really read them fully. And so some of it may also just be awareness of people who are using the services, and some of it may just be lack of choice. Now, aside from virtual walk-in clinics, I should say that virtual care, of course, is still there and something that people are engaging in. But the most common modality that people are using with their existing family doctor or NP seems to be telephone, which at 71%, and only about 18% said they used email or secure messaging, and 5% said they used video. We did ask people, when it comes to virtual care with your own family doctor, how would you like to get care, ideally? And in-person scheduled appointments was certainly the most important type of appointment that people wanted. That was followed by telephone appointments, and then followed by drop-in or walk-in in-person appointments, and then email or video. Our next section of the survey asked people about their views on teams of health professionals. So one striking finding in our survey was that very few people in Canada who did have a family doctor or NP had a doctor or NP who were working with other NPs or other health professionals within their practice. So about 36% said that their doctor or NP worked with a nurse, about 31% said they worked with a nurse practitioner, but it was really like 13% or under who reported that their doctor or NP worked with a pharmacist, a dietitian, a social worker, or other health professionals. In contrast, when we asked them, well, what do you think about using team-based care? 90% of respondents said that they were comfortable getting care from another team member if recommended by their own family doctor or NP. And then we asked which health professionals do you think would be most important to have as part of the team? And again, they could check as many options as they wanted. The most common was a nurse practitioner, 75%, followed by nurses, pharmacists, psychologists, and physiotherapists, and social workers. So the last section of our survey was just about reimagining how we organize primary care. We asked people about this idea of how about if, in some countries, primary care is organized more like a public school system, how the public school system is organized in Canada. Is that something you would support? And so 72% said yes, they agreed that teams of family doctors or NPs should be required to take as a patient anyone who lives in their neighborhood in the same way that public schools have that mandate. Of course, and I think we had a caveat there even in the question about, that there would need to be resources to make that happen. And then we asked that question with a caveat. We said, would you still want that to be the case if it meant that you would have to actually change providers when you moved? And 66% said, yeah, they still agreed that should happen, that they should be guaranteed a family doctor in their neighborhood, even if it meant that people would be encouraged to change their family doctor or NP when they move. We asked people a whole bunch of questions about their willingness to have other kinds of care. 91%, interestingly, said they were willing to see one NP consistently for most of their care, except for when a family doctor was needed. 65% said they were willing to choose from a list of available family doctors or NPs and close to their home instead of being able to choose anyone in the province. And 76% said they're willing to see any family doctor or NP in a group practice with shared records, even if it meant not seeing the same person consistently. So all this to say is that based on kind of this, we get the sense that people are willing to have different kinds of care. They seem to prefer reforms where it would allow still for a relationship with one individual. So in this case, for example, many people were very supportive of being able to see an NP consistently for most of their care, but they seem that they would be okay to settle for something. For example, 76% that they would be willing to see any family doctor or NP in a group practice if there were shared records. And so they wouldn't have a consistent relationship, but they would be willing to give that up and settle for continuity in information, even if there wasn't continuity in a relationship. So I wanted to end really by telling you a little bit about how the data from Nova Scotia stood out. So I will say one caveat here is that we probably only had about 200 or so people respond from Nova Scotia. And so these numbers are not as robust as for the rest of Canada. But it did seem there are some differences that seemed fairly notable. So it seemed like more people in Nova Scotia reported not having a family doctor or NP, about 29% versus 22%. More people reported having an NP versus a family doctor if they did have a provider. So that interestingly, in all of Canada, only about 5% said that they had an NP as their primary care provider, whereas in Nova Scotia it was 16%. And more people in Nova Scotia, not surprisingly, were trying to find a new family doctor, 43% versus 29%. More people in Nova Scotia reported using a government agency or service to find a family doctor or NP. So I didn't show you that full response for all of Canada, but you can see that, yeah, more people in Nova Scotia were using that kind of service. More people in Nova Scotia who didn't have a family doctor reported trying to get care in a hospital emergency room the last time they had a non-urgent health problem. So that's 44% versus 24%. And it seemed that more people in Nova Scotia were open to new ways of organizing care. So remember when I said, what if we organized like the public school system, but suppose you had to change providers if you moved? Well, in all of Canada, that was 66%, whereas in Nova Scotia, it was 74% agreed with that kind of change. And no doubt these kind of willingness is probably related to the fact that many people more in Nova Scotia don't have a family doctor or NP. I know Ruth wanted to just jump in to add some color to those, but I'll just end off before she does that by just saying that I've actually only provided you a snapshot of some of the data. There's actually so much data within that we received from the survey that we've actually put it all online in this tool called data.ourcare.ca. So you can go onto the tool yourself and query the data. You can see the overall Canadian response, and then you can actually see the response by region, by gender, by rurality. So lots and lots of information there. We've also done a series of blogs in Healthy Debate where we have really tried to look at some of the key issues we talked about today. So, what does it say? Like, what do the responses around virtual care really mean? How about the reimagining care? We try and contextualize some of these responses into the broader evidence and literature and health system kind of context around primary care. So if you're interested, I definitely suggest taking a look at these blogs. And I know Jasmine will also be circulating a one-pager that summarizes the key findings, as well as a Globe and Mail article that I wrote summarizing the findings. So I'm going to end slides there, and maybe I wonder if I could invite Ruth to just say a little bit more about the results, because I think you had some reflections, Ruth.
Oh yeah, I don't need to talk for long. I mean, just three things. The first, in terms of those differences in people looking for a regular place of care who don't currently have it, we know that has been a longstanding issue, and also that with recent movements, that has become more of a challenge. So that is as expected, but doesn't take away from the fact that it is a current challenge Nova Scotians are contending with. The second piece on that, having a nurse practitioner that again, just to connect it up to those Nova Scotia specific settings, that's likely in one of those collaborative practice team or family practice teams. So it does show that there's been a little bit more rollout of people who can provide care other than family doctors in Nova Scotia than other jurisdictions. And then finally, those people using a government service to try to connect to care, that would be the NEDA Family Practice Registry. I don't know, some folks might be on it or have heard of it. That's the line that they would be referring to. And again, a reason that might be different than other provinces is that not all provinces even have a mechanism like that to connect folks to care. And it's been fairly widely publicized and been in the media for a bit. So just wanted to connect it to that specific line in case people don't know about it. So that's all for me.